Good morning. My name is Jerry DiColo, and I'm the Metro editor at the Times-Picayune. Millions of Americans are now eligible for a coronavirus booster shot, but many still have questions about who can get one, when they should get one, and why boosters are needed. That's why we've assembled an expert panel to help answer some of those questions. First, we'd like to thank our sponsor, AARP. And before we get started, we'll be showing a short video from them.
AARP Louisiana would like to thank the Advocate for this timely and important conversation with medical experts to discuss the ongoing COVID-19 pandemic. I'm Bobby Savoy, AARP Louisiana Volunteer State President. AARP is a nonprofit, nonpartisan member organization that has been working to promote the health and well-being of older Americans for more than 60 years. Over the past several months, AARP has hosted numerous teletown halls with several thousand of our members to share important resources and information on how to stay safe and protect themselves and their loved ones during the COVID-19 pandemic. As the Delta variant continues to spread across the nation, it is still critically important to remain vigilant and follow the advice of medical experts and your physician. AARP is also urging all eligible Americans to get the vaccine, as well as the booster shot when it's available, to ensure they stay protected from the deadly coronavirus and put an end to this pandemic once and for all. Personally, I have received both doses of the Pfizer vaccine as well as the Pfizer booster vaccine. How was I affected? Shots number 1 and number 2, no effect at all. The booster, a mild headache and a sore arm at the injection site, both of which were gone within 24 hours. But different people will be affected differently. None of us knows what lies ahead with the virus. All we can do is keep taking the precautions recommended by the Centers for Disease Control to protect our health and that of our children and grandchildren. Your health and safety during the pandemic is our #1 priority, and we encourage you to get the latest updates to make the best choices for you and your loved ones. You can stay updated on the latest information about the coronavirus vaccine and booster shot by visiting www.aarp.org/LA.
Now I'd like to introduce Times-Picayune and Advocate health reporter, Emily Woodruff, who will be leading our panel today. Emily?
Thanks, Jerry. So booster shots are now recommended for some people for all 3 of the authorized vaccines in the United States. But as Jerry mentioned, when you should get it, who should get one, it varies by the type of shot you first got. And I know it can feel at times that this pandemic is moving really quickly, that there's a lot of new information to digest, and sometimes that changes based on new data. So today we've gathered 3 experts to answer any questions you might have. Here today we have Dr. Catherine Baumgarten, a physician and Ochsner Health's Medical Director of Infection Control and Prevention. Dr. Michael Hagensee, a physician and professor of medicine and infectious diseases and microbiology at LSU Health New Orleans School of Medicine, and Dr. Alistair Ramsey, a department head and professor of microbiology, immunology, and parasitology at LSU Health New Orleans School of Medicine. So I would love for all of you to tell everyone the meaning behind some of those titles, and just tell us a little bit about what you do and how COVID-19 has really impacted your work. And Dr. Baumgarten, we can start with you.
Sure. Thanks so much for having me today, Emily, and thanks to the audience for being here. Hopefully we can answer your questions and maybe put to rest some of the concerns you may have. My background is as an infectious disease physician. I have been with Ochsner since 2000 and an infectious disease physician since then as well. And so largely have seen patients that may have various infectious diseases. And then I'm also the medical director for infection prevention and control. And my role there is to prevent infection among our patients and among our employees that work at Ochsner. Since COVID, I've been basically full-time preventing and implementing processes and protocols and prevention around COVID. and have really devoted 24/7 to COVID care, treatment, and prevention. So appreciate you having me today, Emily, and thanks so much for hosting us.
Yeah, thank you so much for being here. Dr. Hagensee.
Yes, also I'm happy to be here and hope we can answer any questions that the audience may have as well. I've been MD, PhD, and I've been an infectious disease specialist here at LSU for over 25 years. And also been doing some basic research along that way, usually based on a different virus called the human papillomavirus. But since the pandemic started, we all kind of switched gears and focused a lot of attention to the COVID-19. Like Dr. Baumgartner, I've been involved at the University Medical Center in terms of developing treatment guidelines for patients with COVID and preventing spread of COVID. But also we've been doing a small serological study in my research laboratory to look at people in terms of how long they have the antibody response and the responses against after the vaccination, and working with Dr. Ramsey along that as well.
Great. Well, thank you for being here. And Dr. Ramsey, tell us a little bit about your work.
Yeah. My name's Alistair Ramsey. I was born in New Zealand, trained in Australia, and came to LSU Health Sciences Center here in New Orleans in 2000. I'm now the head of the microbiology, immunology, and parasitology department, and we teach research students and medical students here. In my own work, I'm kind of a guy who works on the immune response to viruses and other intracellular infections like tuberculosis, and we've got some good models for that. In terms of COVID, Dr. Hagensee mentioned a study we're doing together to monitor antibody responses up and down, and particularly neutralizing antibody responses in patients given the vaccine who may or may not have had COVID. And we also have various other studies going on to look at host response or host immunity to infection and vaccination. And that's kind of my key area of interest in research.
Great. Well, thank you. I think between the three of you, we have a lot of experience and we'll be able to answer anyone's questions. So just go over the basics first. So for Pfizer and Moderna, who should get it? And for Johnson & Johnson, who should get it and when? And how are those recommendations different? And maybe Dr. Baumgarten, you could just kind of walk us through what the CDC has said, who should get it and when.
So there's, it's not as simple as it used to be. It used to be we got 2 vaccines if it was Moderna or Pfizer, and 1 vaccine if it was J&J, and that was it. So things are a little more complicated now. And so we have a lot of information. The CDC has a lot of information. The Oxford website has a lot of information. I'm sure LSU has a lot of information online too about when to get your booster shot. So if you're confused, I'm going to walk through it as simply as I can. But if you're confused, you can always go online and find out whether or not you're eligible. So for those that have gotten Pfizer and Moderna as a primary series, 2 shots, and then J&J 1 shot, you're considered fully vaccinated 14 days after that series. So 2 for Moderna and Pfizer, 1 for J&J. After that, if you're somebody that's immunocompromised, meaning you're someone that has a vulnerable immune system, maybe you got a transplant, maybe you're on prednisone or a medication that suppresses your immune system, 28 days after you get that last dose of whatever vaccines, you're eligible for a 3rd dose. That's called an additional dose. We don't technically call that a booster, but it's an additional dose. So for those that are immunocompromised, we know your immune system may not produce as much antibody response or as much immune response to those primary series. So the CDC has said it's a good idea for you to get that additional dose. Now, what we're focused on today is booster shots, which were most recently approved by the CDC, the FDA, and the ACIP, which is that subcommittee of the CDC. And booster shots are those for that have maybe some other immune conditions. So for the Moderna vaccine and Pfizer vaccine, it's anybody over the age of 18. It's because immune system wanes over time. We know that happens from the data. And if you have an underlying medical condition or you may be at high risk before getting exposed to COVID, such as living in a congregate setting, a high-risk setting, working in a healthcare profession, being in transportation where you might be exposed to a lot of people, and you're 18 and above, you should get a booster dose. And for the Pfizer and Moderna dose, you can get those. If you got the J&J, you can get a J&J as that second option, or you can get Pfizer or Moderna as that option as well. And then for anybody over the age of 65, a booster dose is indicated. And for J&J, that's 6 months after, I'm sorry, for J&J, it's 2 months after your J&J vaccine. For Pfizer and Moderna, it's 6 months after. So it's very convoluted. I apologize for the long explanation, but it's a little bit complicated depending on what vaccine you got and what your condition is.
Okay. So yeah, I think the questions I get a lot are based around maybe some of the language that is used to recommend these booster shots. So you go on the CDC website and you see things like you may get one, or they allow for it, or they recommend. So Dr. Hagensee, I know you've done some work on how vaccines are presented in general to the population. What do you make of that kind of language? And is this a really solid recommendation as far as like you should get it, or how should people think about those recommendations?
Well, again, we apologize for the confusing messages, but obviously this is an evolving science as we move forward and try to adjust to the data that we have coming in and stuff and information like that. So it is unfortunately more complex than it should be. I think the data is really pretty clear that we would highly recommend booster shots. And in a couple of different venues. Dr. Ramsey and I are doing a small study, and we're seeing most people after vaccination, their serological responses do go down, do seem to reduce. And Dr. Ramsey can talk about the neutralizing titers, the ability of those antibodies to actually prevent infection. But also there's been a number of studies now looking at people who got the booster vaccination and then looked at their rates of infection with COVID shortly, like 14 days after, and they're dramatically lower than if you didn't get a booster. So that's kind of the real world human experiment. And it kind of shows that boosters are providing additional protection. So I believe that, I would highly recommend everyone who's eligible to get a booster to get a booster.
Okay. And those studies, I just want to make clear real quick that safety has also been proven in these studies. So, the main thing this is measuring is more like, is this providing an additional response, and also measuring the safety, but that has never really been in question.
Yeah, correct. The safety hasn't been a major issue at all in any first, second, third doses of any of the vaccines. It's been a very small number of usually just mild side effects, like we had in our introduction speaker. And then again, the rates of either COVID infection or serious COVID infection after the booster is dramatically lower in those that get boosted compared to those who don't get boosted.
Okay. So what we're really studying is, is this effective? And it does seem to be pretty effective. Dr. Ramsey, maybe you could tell us a little bit about what you've seen in your study and, what you're reading about in other studies as far as effectiveness and what happens really when someone gets that third shot.
Yeah. As Dr. Hagensee said, we're monitoring the antibody responses as they go up and down after different shots. And we've got a bunch of people who come in and have been kind enough to donate samples at various stages before, during, and after each shot, or before and after each shot. And it's pretty clear to us that the second of the two original shots, which constitutes being fully vaccinated, in the case of the Pfizer and Moderna, and we're just working with the Pfizer one because those are the patients we have. They have a low antibody response after the first shot, a much, much higher one after the second shot. But it's pretty clear within about 4 months that comes back down. And in terms of the neutralizing antibody that Dr. Hagensee mentioned, that's the one that actually binds to the virus, prevents it from actually infecting your cells. That's come back down almost to the level of the first shot after about 4 to 6 months. So I think that fits well with the the suggestion that we should have a booster after 6 months. I mean, the data's out there, and other studies with bigger numbers than us and have a little bit more advanced have shown that the booster does dramatically increase the immune response, but it definitely has waned a lot before that. And I think it's just characteristic of the immune system and the concept of immune memory that if we regard the first 2 shots as the initial vaccination and the booster as a true boost, you'll get a much more sustained, typically sustained, long-lasting and better quality antibody response after that booster. We wouldn't expect it to go down, and I think the data as quickly as it does after the first 2 shots. And I think the booster sets you up for a high-quality, long-lasting immune response, and the data are starting to show that.
So I think the question a lot of people have when they hear this, that it starts to go down at 4 months and we need another one at 6 months, is they're thinking, wait, did my first 2 not really work that good? Am I still protected? So, what would you say to someone who's asking that about whether their initial series is still protecting them from, severe outcomes or, symptomatic infection?
Absolutely. I mean, it's very clear that the vaccine has worked wonderfully well in preventing severe disease, hospitalization, and death. And we actually just don't know how closely the levels of antibody, we assume higher levels of antibody give better protection against infection. But beyond infection, there's the development of disease. And it's very clear that the first 2 shots have provided an enormous amount of protection. We heard figures like 92% and over 90% for Pfizer and Moderna, and a little lower for J&J. So it's clear that that first 2 shots are very important and have provided a lot of protection. The booster is in response to the fact that the neutralizing antibody response wanes a little, well, quite a lot, but so it gives you a chance to boost that up and prevent infection as well and transmission. But it's pretty clear, just to answer your question, that the first 2 shots do give significant protection against serious disease and hospitalization.
Okay, and those first 2 shots, they're also stimulating more in the immune system than just the neutralizing antibodies, right? Like you can count on some other things kind of kicking in and perhaps, remaining with you for longer than 4 months or 6 months.
Yeah, that's a great point. I mean, there's a few studies out there. We're all focused on antibodies because those are the things that were measured in the clinical trials. But I think even the clinical trials and people are still looking, Pfizer, Moderna, and are still looking at those people for 2 years at least after the trial. And a lot of studies have come out showing other arms of the immune system that play a role not in preventing infection, but in dealing with infection, like your T cells. They may be longer lasting than antibodies. They certainly play a role, and we're only finding more and more. If other diseases are any example, it's pretty clear that a strong T cell response, particularly for a virus infection, also plays a key role in preventing disease and helping to get rid of the virus out of your body. So I think it's pretty clear that there'll be what the data is showing, there'll be a good T cell response, which can only be improved in a memory response with the booster. But those studies are kind of less advanced and more complex, but there's certainly studies coming through in the literature to show that the whole panoply of immune responses is being generated against these vaccines.
Okay. All right. And we've asked our audience to send in their questions ahead of time. So I'm just going to try to get through as many as we can. A lot of people want to know if they had, they're vaccinated and they had a breakthrough infection. So they got COVID, maybe it was pretty mild. How long do they need to wait after that infection to get a booster shot? And Dr. Baumgartner, do you want to take that?
Dr. Baumgartner on that.
So really the CDC says when you have an infection, you don't want to get a vaccine when you're in that isolation period. So typically that's 10 days for somebody that's at home with mild symptoms. So you can get your booster according to the regular schedule as long as you're 10 days out from COVID itself. So again, for the J&J booster, that's 2 months after that initial J&J. And so if you got J&J initially, you can get a J&J at 2 months. You could get Moderna at 2 months. You could get Pfizer at 2 months. Any of those options are available to you. And then if you got Pfizer or Moderna, you want to wait 6 months from your last dose and 10 days since you've had COVID itself. Now, a lot of people ask, well, if I had COVID itself, do I really need a booster? And that's something that's a reasonable question to ask, right? The CDC is still recommending that booster shot for those that are eligible, even if they had prior COVID infection. And that's based on several studies that showed that, we know that those that are vaccinated have a lower risk of getting infection in households, especially if you're elderly, if your immune system's at risk. So that is still recommended by the CDC at this point in time. And I'd love to hear if Dr. Ramsey or Dr. Haggins have additional comments on that.
Yeah, we've had a few people like that, and clearly their serological response goes up dramatically. They've had documented COVID infection, they're making a good antibody response, and then they get vaccinated, and they get a tremendous higher boost in their antibody levels after that. And the other thing too, we've been doing a little bit of work of the Delta variant, because that's been something very topical over the summer. And if you got a natural infection against what I would call wild type COVID, you didn't necessarily have a very strong, at least antibody response against the Delta. That might have been, some of the breakthrough cases might have been due to that. As Dr. Ramsey said, there are other parts of our immune system that probably help fighting that off. But clearly, if you got vaccinated, you did have strong antibodies against both the wild type and the Delta. And so I very highly encourage even people who got COVID and they think, hey, I'm immune. Yeah, you may not be fully protected. And I highly recommend getting the vaccine after natural infection.
Yeah, I agree, Mike. I think everything I've read shows an enormously strong response in people who have been vaccinated after they had COVID, provided that the correct period is waited. So it's a resounding yes. You should definitely take the vaccine when recommended if you've had the disease earlier.
Well, there's a little bit, there is a small study that I always like to talk about too, because this is a question from lots of people that we get all the time. Why do I need the vaccine if I had COVID? And there's one small study that we think shows that even if you had COVID, but you get that vaccine, that immunity that you have is broader. And so our concern as infectious disease physicians is what's next? We don't want to be doom and gloom, but we are concerned about, okay, is there another variant that may be coming down the road? And we hope not, but the reality is there could be. And so if you have a vaccine and you have that chance of having broader immunity to whatever is coming down the line or coming down the road in terms of strains of COVID, then that's a good thing too. So you might be better protected. It was a very small study, but nonetheless, one that I've seen and have talked about with other people to try to say, okay, the vaccine is still the way to go, and we still recommend that. And that's why the CDC and experts are saying, including all of us, yes, get that vaccine, even if you had COVID.
And one thing this kind of reminded me of, because I think I've heard from people who are saying, well, I don't see my job on the list of people who are recommended. So do I really qualify? Do I really get one? And I know in other countries, the recommendations are much wider, that they allow more people to get this booster shot. So what would you say to someone who's trying to make, someone like myself, for example, I work in the media. I'm not on that list, but I'm often in situations among a lot of people where I might be exposed to COVID, especially as a health reporter. So what do you say to people who are questioning whether they qualify?
Well, I think the CDC guidance is that it's guidance, right? And we're not restricting those who can or cannot get the vaccine. The restrictions are really on age. But if you are in a situation where you may be in contact with crowds, when you may be in contact with the general public, where you may be in environments where there are people that you don't necessarily know, or you may be even traveling and you're among people in an airport. I mean, to me, those are higher risk settings and situations. And I'm one that says, if you're in those situations and you have concerns, then get the vaccine. I mean, there's other things that play roles in get the booster vaccine. There's other things that may play a role in this depending on the level of COVID in the community. Fortunately, right now we're at a lower level, which is good. But if that changes or rises, then every encounter you have more of a risk of being exposed to COVID again, right? So, these are things we take into consideration and the CDC takes into consideration when making these recommendations. From my standpoint, I'm always in favor of if you feel like you're in a higher risk setting or exposed to a lot of people in the general population, I would recommend getting it. I don't know if that helps, Emily. And then I'd like to see what Dr. Hagensee and Dr. Ramsey think of that too, but that's kind of how I see it.
I think I agree with it 100%. And I think I know people myself who have gone along to Walgreens or pharmacy and made the case and they get the vaccine. I mean, they're not going to stand in your way if you feel you can self-report a condition that requires it.
Yeah, I got the booster here at LSU, and they were they don't turn anybody away. Let's just put it that way. And if you feel you're at risk and you want a booster, you can get the booster.
Agree.
Tell me about that.
So I want to circle back to the mixing and the matching, because I think there's also some vague sort of language around this that it's really been just said like you can get whichever one after you've already received the initial series. And I think people are more used to receiving like a really set recommendation, like you should do this, you should do that. So tell me a little bit about your thoughts on, let's start with Johnson & Johnson, folks who got the Johnson & Johnson. I know we were talking earlier about how there is pretty good evidence that maybe they should get a different vaccine, right? And Dr. Ramsey, I think you were talking about that.
Yeah. I mean, I've always been a big proponent of this because some of our early research was on heterologous prime boost vaccination, and we know that giving certain vaccines with different platforms can lead to a markedly better response. And I think other countries have already begun to do this. And now the NIH very interestingly published a study a month or so ago where they were just looking at antibody levels after people who had been given different combos of those vaccines. And just to talk about the J&J one, I think they found that boosting with a J&J, if you'd had a J&J, gave you a fourfold increase in antibody that was sustained. But boosting with a person J&J immunized with a Pfizer or Moderna, it was about a 60-fold increase in antibody. And those are hard data now on large groups conducted by a respected organization. I think we're going to see more and more data like that coming out. So they didn't say avoid a boost with J&J. You may be more comfortable with that. It's still protective. But it's pretty clear that mixing and matching can be very effective in terms of the level of antibody, in this case, that was produced. And, we have some studies in other areas showing that other arms of the immune system are equally boosted by presenting the vaccine in different platforms. But anyway, that NIH study was very encouraging that mixing and matching is feasible. And I bow to my clinical colleagues, but I think there's no barrier to that now, right? That's becoming acceptable.
Now that's good for patients because in some cases they may not remember what they got even on their vaccine card, or Pfizer's right. They got Moderna, but Pfizer's right at the hospital, so why can't we just get Pfizer? So it's a lot easier for them now just to get whatever you can get, and that's good. And I had some early work in my career too that mimics what Dr. Ramsey saw, that was kind of heterologous. One type of vaccine followed by another type of vaccine seems to work. And the J&J efficacy was a little bit lower than the Pfizer and Moderna. So if someone is focusing on that, then I would say absolutely get a Pfizer and Moderna as your boost, because you may well, like that study showed, you might have actually more sustained and a higher response level. I'd like other people's opinion about, do you think the Pfizer and Moderna, since they're kind of basically the same platform, would that give any different? I don't think so, but I don't know. I haven't seen any data on that.
Yeah, the only thing I know about that is there is a lot more antigen in the Moderna vaccine than there is in the Pfizer, about a 3-fold increase. But it seems as though the early data were pretty much the same with those. There were points different. As time's gone on, the Moderna may be marginally more protective, and it could be to do with that. Or different parts of the immune system. I mean, we're getting down among the weeds now in terms of looking at the immune responses. And it seems as though there are slight differences, but as Dr. Hagensey said, they're basically the same formulation.
Right. And then, for the Moderna booster, we're using a half dose for the booster.
Right.
The Pfizer, we're using a full dose. So then you become very, what do you do? So,
Right.
Pfizer, Moderna, whatever is offered to you is a good choice. And what we know is all of them prevent severe disease and hospitalizations. And, I think clinically there are some people that prefer the J&J for side effect profile or what have you, or maybe they only, at least initially wanted one shot. So getting a booster with any of the three is better than none if you're in those risk categories or immunocompromised or that sort of thing. So we would encourage you to get whatever booster you can or you're comfortable with. But certainly I agree with Dr. Ramsey and Dr. Hagensey that, if you got a J&J and you don't have a contraindication to Pfizer or Moderna, we would recommend a Pfizer or Moderna in that case if that's something that you're agreeable to or can do.
Okay. Should we be thinking about the J&J as a kind of like a 2-shot vaccine at this point, or do you still consider it a 1-shot just because the numbers seem so much better when you get that second dose?
Well, technically, the CDC has still considered fully vaccinated as that one J&J. I think that's going to be a remain to be seen, sort of philosophy and see if they change it. But as of now, they're still saying the J&J, as a single dose provides that good immunity, prevent hospitalization, serious disease, that they're not yet making a recommendation as a series. But I don't know if Dr. Ramsey or Dr. Hagensey has heard anything differently or if there's any newer information. That's the last that I've read or known about.
Yeah, no, I don't know any newer information than that, and I kind of agree. I guess if someone got the J&J and came from me to advice about boosting, I'd probably really stress that they really need a boost, either the J&J or the Pfizer Moderna, since they only got the one dose of J&J. This meeting, I would probably kind of push it a little bit further than I would on another patient, because I do think that in the J&J case, that second shot, whatever it might be, is very important.
Yeah, I think it can be seen as a booster, just as 2 shots of Pfizer and Moderna was the initial and 1 shot of J&J. We're all ready for boosters now down the line.
Yeah. Okay. And people have some just kind of logistical questions. They want to know where to get it. They want to know, can I get it right now? So the answer is yes, you can get it. You can get that booster shot right now for any of these, as long as you're the recommended amount away from your initial series, right? And then what do you tell patients, or tell your friends and family about where to find this vaccine?
Well, the good news is it's widely available. So, the pharmacies, clinics, of course, Auctioner here, we have, it available in clinics and in other locations and other events, Lakeside Mall, that sort of thing. And people can go to my Auctioner and schedule appointments, and then also go to myauctioner.org/vaccine info or call 1-844-888-2772 to schedule an appointment or visit. But it's widely available, and I'll let Dr. Hagensey and Dr. Ramsey speak to their options for availability too. But that's the nice thing is the CDC, FDA have really wanted to make the vaccines easily available to people, and we're finally at that point where they are. They've changed the storage requirements. They've changed a lot of things to just make it easier to get this vaccine out and about.
Yes, at the University Medical Center, it's. You can either find that information on their website or they do require an appointment, but you can walk up and make an appointment right then and there because there's usually only a few people in line. So it's no real barriers. And then, a local pharmacy, if that's closer and easier for you, that's also available. Certainly Walgreens, I believe CVS also has it.
Yeah, and some of them have dedicated immunization windows now where you can just rock up and register, as Dr. Hagensey said. So I think the availability is becoming less of an issue.
And it remains free to everyone. I just want to make that
clear
as well.
Yes, free to everyone, and you can walk up and get it. So if you happen to see a location and there's a vaccine available, just walk up and ask. We want to make it as easy as possible.
Okay. A question I get a lot, and I think you probably all do too, is are we going to have to keep doing this? Is this going to be like I going to have another panel in 6 months about this? Or we, what does this look like? Is this something, like you said, like a tetanus booster where you get it every 10 years, or is this like a flu shot that you get every year? I know it's hard to predict, but what are your thoughts?
Well, let's get out the crystal ball, right? That's what we always laugh about. We got to get out our crystal ball. But I'd love to see what Dr. Hagensee and Dr. Ramsey think about this too. But, we've talked a lot about this among our team, and, people are developing more immunity. So, it is that wait and see phenomenon. So we'll be, CDC, those that are making these vaccines, Dr. Hagensee, Dr. Ramsey are studying this to see what happens with immunity over time. My suspicion will be we will require boosters. How frequently, I think, will remain to be seen. And also what will affect that is whether or not we see additional variants or, strains that may not be as covered as well by the vaccines. The good news is if that were to happen, I think it's a plug and play. We've done it. We have the vaccines available. It'll be available more quickly. If that were to happen, that we would have a booster that would be effective. But I think those are certainly things that will play into what we see in the future with boosters. But my prediction is there'll probably be some more boosters, maybe similar to flu vaccine right now, where we have to get it every year to make sure we're protected. So that would be my thoughts, but I'd love to see what the rest of the panel thinks too.
Yeah, the flu vaccine is a little different. I mean, it changes every year, right? I mean, it's a 3-component thing, and they try and predict what's going to be circulating. So far, the boosters for COVID have all been based on the same strain. There is a word that some of, certainly Pfizer and probably Moderna are looking at making vaccines against Delta, for example, and some of the variants, and they won't have been released yet. They'll have to go through the same process. But so far, you've got to emphasize that the vaccine that's out there on the market is protective against all the strains that are circulating. There will be new strains, and viruses are horrible mutators. The less people that are vaccinated, the more chance they've got to infect people and create new strains. So really getting vaccinated helps against that too. But there will certainly be mutation in new strains. And so far, we're lucky enough to know that even though there might be some variability, the vaccine is protective against all of them. And when we start studying other components of the immune response that tend to be more cross-protective against different strains, we may get some good news there. But I agree with Dr. Baumgarten that we will be facing boosters, whether it's the same thing. There's a new Delta variant called Delta Plus. Now, do we know? I would bet that this vaccine that we have is protective, but the virus is always trying to run away from protective immunity. So we've got to sort of corral it and give it less people to infect. But so far, so good. But I think the booster will be with us for a while.
I just want to reiterate, I agree with both Dr. Ramsey and Dr. Baumgartner on that hypothesis that we're going to continue to look in the future, continue to monitor new infections, continue to look for mutants, look at patient serum to see if they're making responses, see if the vaccine covers some things along those lines. I mean, the coronavirus, generally speaking, doesn't mutate that much compared to some of the things like HIV that we studied. It mutates a lot. However, we've got millions or billions of infections worldwide. So even though it doesn't mutate much, there's a lot of replication out there. And people ask, why is this thing changing so fast? And it's not really changing that fast. It's just it's a pandemic, and there's billions and millions of people that are affected. So a small rate of change multiplied by that leads to new things that escape our immunity. And Dr. Ramsey alluded to, and Dr. Baumgartner as well, if we can get more and more people vaccinated worldwide, then that would be harder for the virus to escape that pressure, and hopefully we can curtail things. I think Dr. Ramsey also mentioned that hopefully with this, these boosts, we might see a longer-lived immunity, at least against the wild type and the current variants. And maybe we don't have to do it every 6 months, maybe every year as we move forward.
And Dr. Baumgarten, you kind of alluded to this, but when a new variant come along, when and if, you said the vaccines are kind of easily, you said plug and switch or
Like,
Plug and
Yeah,
play is what.
yeah, plug and play.
And I don't know if that's a thing, but that's what I.
I knew what you meant.
So I mean,
Yeah,
I can
tell us
I
a
can
little bit
explain a
about
little
that,
bit
yeah.
better, and but you know, now that we have the recipe for the vaccine, I guess that would be the easiest way to describe this. What the companies need is if we were to see a new variant, they just need the genome of that variant, and the genomes now are very quickly. We're able to get those genomic information very quickly within a matter of days. I mean, even when we first had COVID-19 with in China, you know, they shared that recipe very quickly. And now that these mRNA vaccines have been developed, have been studied, have been given, it's just a matter of then plugging that recipe in and then producing the vaccine. And so the timeline is much less, it's a shorter timeline than what it would have been otherwise. I would liken it to when we had H1N1, and I don't know if you remember that, but I do for sure. And, you know, in 2009, when we saw H1N1, fortunately, we were able to get a vaccine more quickly than we were with COVID because we already had flu vaccines. And, you know, we're changing those strains each year, like Dr. Ramsey and Dr. Hagensy mentioned. And so we know that, and we knew that with the flu vaccine. And when we had H1N1, we were able to then get that vaccine produced more quickly and get it to people more quickly. And that'll be the same with this one. I think it would even be faster than what we saw with H1N1, honestly. So I'll let them comment as well, Dr. Ramsey and Dr. Hagensy, but that would be, you know, my prediction and what would happen if we were to see a different strain.
I couldn't agree more. I think that's a great point. It's a miracle, the RNA vaccines, and I think if anything good can be said about the pandemic, it accelerated their development, and they've turned out to be miraculously effective. And I think in terms of, as Dr. Baumgartner was saying, in terms of mixing and matching, they're going to be a platform for vaccines against all sorts of diseases from now on, and they can be very quickly adapted in the lab and by the biotech companies to produce a clinically useful vaccine much quicker than we've had in the past. And the whole process is showing us how quickly we can go with an effective vaccine while remaining safe. So I think they're miraculous, and I think they will be able to accommodate rapid changes, as Dr. Baumgartner was saying. I think what we need to do is get more parts of the world, you know, being with the capacity to make them, but that's the next step.
Yeah, I agree, and I think one of the concerns of the RNA vaccines when they came out, because it was kind of a new way of doing things, is the side effect profile, which has been very extraordinarily low. And now if we do need to develop new vaccines against new variants, we already know the side effect profile is going to be low. And we'll test it and make sure that any new vaccine will be fully tested. But I think a lot of us will feel very, very comfortable that we're not going to see any brand new side effects now that this platform's been really well developed and well tested both before it came to general population. Now we've got this many millions of doses given now, so we have that data as well.
I think that's a great point. And we are studying, or the mRNA vaccines, like Dr. Ramsey mentioned, are being studied with other viruses too now. I just, read about it being studied in flu. How great would that be to have an mRNA vaccine for flu? So, it's now opened this ability to study these vaccines for other viruses as well. So it's wonderful.
And I know, we have 3 vaccines here in the US, but there are actually like hundreds, right, that are being studied. There are so many out there. Could you imagine a future in which, another type of vaccine might prove a match for any kind of variant or that we might see other options? Or how do you think that will play out?
I think, there's a company called Novavax, for example, that are very close to releasing a protein-based vaccine, which is much more like traditional technology. It's probably less, a little more expensive to make, but they're in advanced phase 3 clinical trials now to look at efficacy in the population. Other countries, China has developed its own one, Russia has developed its own one. These have come into other countries. Varying efficacy, but our focus is obviously on the ones that the FDA and the CDC have approved. But I also read that people are looking into a locally applied vaccine. So all sorts of options, so you can sort of inhale it.
Mhm.
We've got great vaccines now, but as you say, there are other platforms and technologies being looked at, and quite frankly, the more the better, because this is an international problem and we need to develop vaccines that can be safely delivered and stored and economically all over the world.
Yeah, I agree. I mean, most of the vaccines to date have really focused on this receptor binding domain where the virus actually infects. We do a little serological work on another protein called the N protein, which is more common across many coronaviruses. And it is possible that other proteins in the virus may make a more effective vaccine against not only this, but also the common cold coronaviruses. But I mean, I agree with the biotech companies choosing where the action is initially, and it works fantastically. But the future may be, as we have more time to breathe and look at this more in depth, that there might be other vaccine targets out there that may allow for less boosters or whatever. But we've got some time before we'll know any more information about that.
And I'd like to just add to what Dr. Ramsey said. I think, when we think about infectious diseases, pandemics, it's an international scale. It starts locally, expands regionally, and with the way that our world works now, it spreads among everybody in other countries very quickly because of transport, travel, that sort of thing. And so anything that we can get more widely available in different countries. I mean, we know also we've talked about the more people that are vaccinated worldwide, the less chances we have of another variant developing. So every vaccine that's available and effective and safe should be out there for worldwide use. And that's one of the reasons that we want to make sure everybody's vaccinated, not just in the US, but worldwide, because these things often start in other areas and then spread. So we want to make sure that we have as many people protected as possible.
And that kind of brings to mind for me an argument I've seen a few people make, saying, oh, should we wait on the booster shot in the US and get these vaccines out to the rest of the world? What do you say to someone who feels maybe a little conflicted about that?
Well, I guess my view, and I don't know that I've spoken to this before, been asked that particular question before. So I'll speak to what I think. But we have it available in the US. We have it here. It's readily available. We don't have it in short supply. And so I think we need to get what's available to us here, but we need to continue to have outreach to other countries, provide to other countries, which we're trying to do, and make sure that vaccine's available to others as well. But the vaccine's here. It's easily available. If you're vulnerable at risk, I would get it.
Yeah, I agree. And I guess the first thing you got to do if you want to save the world is save yourself. Because if you don't save yourself, you can't save the world. And I just, believe it or not, I said there's a very interesting conversation with an Uber driver over the weekend. And he is from Libya. And he goes, it wouldn't matter how much vaccine you dump on Libya. The infrastructure there is unfortunately so poor. And there's corruptness in the healthcare network that it wouldn't help the people, unfortunately. And so that's something that those kind of problems are not something that's going to change overnight. And obviously they need a lot of help in a lot of third world countries to improve that infrastructure so that when a life-saving, preserving method like this is available, they can actually distribute to the people at risk. So, but I think the thing is, save yourself so then you can save the world. I think might be a good message to bring.
Right.
Yeah, and I guess the thought that I had as I was asking that question is that here in Louisiana, the pandemic has been as bad here as it has been worldwide. So, there is a need here to protect people. So, all right. Well, any final thoughts about the booster shot and what you would recommend to folks, or what you'd like to leave folks with as they think about this decision for themselves and their families, especially as we come into the holidays when people will be gathering together a lot?
Well, I just want to say, yeah, definitely, we all recommend getting boosters. I think it's really important. And I also want to make a pitch for those people who are not vaccinated at all yet. Please consider getting vaccination. One thing I think with the Delta was very clear. This is a virus and it will seek out those susceptible. And so if you think you're somehow immune because you haven't had it yet, there'll be a Delta Plus that's coming or something else that's coming. They'll find you because it's a virus and it will infect you, and hopefully you'll do okay. But again, I'm a big pitch for boosters, even a bigger pitch for people getting the primary vaccines.
But, you made an excellent point, Emily, that Thanksgiving, Christmas, and now we're having Mardi Gras here for all the information we received. The timing couldn't be better to have a booster, and it's become available, and the 6-month gap is here now. So get out and have it before Thanksgiving.
I agree completely. Same message. I'll just say it again, just for the third time. Holidays are coming up. This is when we started to see our third surge, actually, right? Was, if you look at our graphs and the numbers going up, it was Halloween, Thanksgiving, Christmas, and in January we peaked after New Year's. And that was just last year. And all of us are tired. Governor John Bel Edwards, I still love to quote him when he said, we're done with coronavirus, but coronavirus isn't done with us. And it's still, I just heard, I was actually had a clinic visit with a nurse this morning, and she was a night nurse. And she told me, I asked her how her night was when I started off the clinic visit. And she said it was kind of rough because I had a patient die. And I said, oh, really? What happened? And she said it was a COVID patient that died this morning. And, we were waiting for the family to get here. We did everything we could, and we still couldn't save this person, and their family was at the bedside, but it was a hard night. So I just want people out there to remember it's much better now. Our numbers are better. We've done what it's taken to get these numbers better, but this is where we want it to stay. And despite the numbers being good, we still have people dying from COVID. And it's preventable at this point. So please get your vaccine if you haven't done so. The holidays are coming up. We had a great Saints game on Sunday, a full dome, exciting game. We're really sad that Jameis Winston got hurt. But aside from that, we want to continue these things. We want to go to the Dome. We want to go to Jazz Fest, to Mardi Gras, to Halloween, trick-or-treating, all these things that we love, Thanksgiving, all the holidays coming up. So please get your vaccine, get the booster. It's the best way to protect yourself, protect your loved ones. If you're vulnerable, you still should be masking, doing all those things to protect yourself, even if you've gotten vaccinated, if your immune system is not, is not as robust. So please protect yourself, protect your loved ones, protect others, and get these vaccines. It matters. And we still want everybody to get vaccinated.
All right. Well, thank you all so much. I just so appreciate your insight and your time and just sharing your knowledge with us. And I really appreciate it. So,
Emily, thanks so much for having us today and for having this forum. It's so important to get the word out about vaccines. And we always appreciate you, being an advocate for that, and appreciate you doing these forums and having us on.
All right. Well, thank you all.
You're welcome.
Good. You're welcome.